Okay, now that we've done the medical condition, we click next, and now we're on to the medical history. Medical history page is where we're going to enter in the medications that the patient is taking or is prescribed. It's important that you ask the patient what medications or what prescriptions you currently have. It's not what they're taking. Sometimes people will say, well, I don't take them. Okay, that's fine. They don't take them for a reason. Maybe they're afraid of them. Maybe they've taken them and they haven't worked. That's the purpose of the PGX screening, is we want to make sure that the medications that the patients are prescribed is the right medication for their particular body. That's when I tell everybody, look, this PGX screening, this is all about making sure that that your body is getting the right type of medications. One size doesn't fit all in this new day. So your genetic background will help dictate which medications are best for your particular body. So what medications? So they get their bag of medications out. They get their list of medications out. They get the prescriptions, and you're going to ask them questions. So what type of medications are you taking? Well, I have this. I take one called sertraline or something like that. What's it for? I'm going to type in sertraline. And a lot of times people won't know how to spell it. So I'm going to go over here, and I'm going to click and type in sertraline into Google, and let's see if we have the right one. Sertraline. Okay, it treats depression, obsessive compulsive disorder, stress disorder, social anxiety disorder, panic disorder. Okay, so what's good about this is we found out that, number one, we found out what medication the doctor thought they needed. You'll notice that there's a bunch of different symptoms that are being treated. I've had a patient before said they couldn't sleep, and they were prescribed sertraline. Okay, well, sertraline, while it might help them sleep, the root of it was depression. They didn't want to tell me depression was it. They was easier for them to tell me that their problems was sleeping. So based on this sertraline, I'm going to copy this, and then I'm going to paste it into the portal over here. So I make sure it's spelled properly. And then, how long have you been on? I don't know, a couple years. Most people don't have any idea when they first started. That's when you want to go into the calendar, okay? Click on that box, and it'll come up a calendar. It's been a couple years. Okay, so about 2016, yes. Was it what month? You remember? Most people wouldn't remember. I don't remember 3 days ago. Anyway. So was it hot? Was it cold? It was cold. Okay, so that's probably in February. February 2016 sound good? Yes. Okay, don't worry about the exact date. That's not critical. It is important that you click it, but the medical records will indicate the exact time it was prescribed. Just get the ballpark idea. The medical condition, you want to get this from your patient, but you also want to put down the other reasons. So sleep, and then depression. We found out depression from the Google search. Okay, what other kind of drugs? Well, I'm taking Oxycontin. So how do you spell Oxycontin? I have no idea. So I'm going to go back over here, going to go into Google, and I'm going to type in Oxycontin, and I find out that it's called oxycodone. Okay, so that's the proper spelling, oxycodone. So you want to copy, and you want to paste. Copy and paste is the best, easiest way to do it. How long have you been on that? I don't know. I had back surgery back in 2010, I believe it was. So you want to find 2010 by scrolling down. Was that in the fall? Was it in the summer? It was in the summer of June. Okay, for pain. That's the medical condition, is pain. Okay, so let's just go on, and you do it. You follow this pattern along the way, okay? You're not going to minimize the medications that they're doing. You want to put them all in there. Okay, then if you want to add another one, you just click add. Okay, so you click add and they say, oh no, I think that's it. So then you go over here to the red, they go over to the red X, and you click on that. That gets rid of it. Now you go on to the next one. Now the next section is surgeries. the previous surgeries. This is when you want to list all the surgeries they had. I had a cesarean, okay. Joe's a guy, he had a cesarean. That's kind of weird. Anyway, had a knee surgery, had his colon removed. You want to make sure you list all this and the approximate dates, okay. This one you're going to have to put down the month and the year, okay. Click so on and so forth. You're going to do that. Now, when you're done, I want to get rid of that. Now, then the next section is probably another one of the most important. This is where we're building a case for the cancer. Okay, so the first one, this is the family members of cancer. Okay, I know my grandfather, he died. That's on the paternal side. You have paternal and maternal. He died of colon cancer. So you want to find it from the list, colon. Okay, age of diagnosis, he was 62. Most of the time, people are going to have any clue how old their parents were, their grandparents were when they died. If they don't, then you have to guess. That's all you can do. Okay. Then how about my uncle? I know my uncle on my mom's side, my mom's brother. So we want to put down uncle right down there. On my mom's side, he had liver cancer. So you want to find liver. Oh, liver's not on there. Okay, so what did we determine earlier? Liver cancer is not on there. So stomach, that spread to his stomach also. So a lot of times cancer will spread. So it spread to the stomach. How old was he? I really don't have any clue. 56 years old. Okay, was he about that old? Okay, that's fine. These are tough questions to answer accurately. Remember, medical records will allow them to verify if they need it. However, most of the time they can't even verify the uncle because it's somebody else's medical records. Your job is to make sure that you get as accurate as information as you can, understanding that you're not going to know the exact type of cancer type of the cancer possibly. You're not going to know the exact date that it was or when they were diagnosed. A lot of times people are diagnosed, they don't do anything about it until 5 years later when it eventually kills them. And even then you can't really verify that. So any other cases of cancer? Yes, my first cousin, she ended up on my dad's side, she ended up having breast cancer. Okay, that's one of the options. She was only 34. Okay, so on and so forth. Now the next section is list the types of cancer that you've ever had. Well, I had melanoma. Okay, or Joe, the patient, had melanoma, and I was 42 years old when I had it. Okay, so that's when you put that in there. Now down here at the bottom, then you have a few more questions. Social history questions. Do you smoke? Have you ever smoked? Do you smoke currently? Are you a former smoker? Okay, use recreational drugs. This one people like to laugh about. Most of the time they'll say never. What you can do is put in what they tell you. Drink alcohol. Oh, occasionally. Okay, do you work around hazardous or toxic chemicals? Most of the time these people are older. They're not even working. So the answer to that question typically is no. How many years were you married? I'm not sure why that is, but 42. It took me 3 marriages to get 42 years of marriage. Again, that's a joke. Then once you have that entered in, then you click next.